Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. 1 in 1,000 children is born with some sort of congenital heart disease. That's according to experts in the field. 2 such people had procedures performed on them at the Duchess International Hospital in Lagos. The hospital management feels these are things the public does not hear enough about, and organize an event to celebrate the successes of the pediatric heart surgeries and to let people know that there is hope for children in Nigeria with heart conditions. Let's see the children in this report. Here at the Duchess International Hospital, a common assertion is that care is not just about treatment or a surgery, but how the patient fares after a procedure. 2 patients who have been in the hospital's lens are teenager Precious, whom her carers describe as quick to learn and fun, and little baby M, both brought in with heart conditions.
A team of cardiothoracic surgeons here successfully repaired Precious's aneurysm, a complete revision and replacement of what we call the aortic root, and she's done extremely well since, and here she is sitting with us. It gives me great pleasure to be able to say that when we speak about reversing medical tourism and asking the population to trust us, this really is what governance means to us. This is one such environment in which we are positioned, and we've done it very, very carefully to adequately reverse the trend of medical tourism.
Small baby with a hole in the heart, a ventricular septal defect, with pulmonary hypertension, meaning with hypertension in the lungs, which is one of the things that can complicate a ventricular septal defect. You have to stop the heart, you have to walk to a special heart-lung machine that is managed by an expert who keeps that patient alive, so we can stop the heart and look inside it and sew a cloth patch to close the hole and avoid all the other critical structures around the hole without damaging them.
Many parents might wonder what symptoms would warrant a need for open heart surgery.
They're using all their energy to breathe and to manage the heart failure, so they don't feed well, they fall asleep while feeding, they breathe fast, and they're very irritable, they don't gain weight.
A team of specialists conducted Precious's open heart surgery in November 2023, while baby M received his in February this year. Precious's and baby M's parents are delighted at the results of the surgery and grateful for all the support they received from the time it was clear that their children needed to go under the knife.
Let me still use this opportunity to thank our sponsor, because the moment he heard about it, Alhaji Sulaiman Adebola Adegunwa, as our father, the chairman of Right Foods Limited, he came through for us. He said, okay, he recommended Duchess. He said the best place as far as is concerned to take this baby for a compounded surgery like this is Duchess. So, and he footed the bill and he was responsible for the whole process.
She was almost getting faint almost all the time. She can't walk a distance. She can't walk very fast. She can't do much work. And that was the day I came back home and she was almost gone. So today she can do virtually everything. The extent of happiness I have that a burden is taken off you. This was a girl that was almost gone.
According to her father, it's a new lease of life for Precious, and the doctors say both she and baby M can have a normal childhood with minimal supervision and grow up as healthy adults. Yes, many conditions we consider the exclusive preserve of adults actually find expression in young people and infants, like the pediatric conditions you just heard about in that report. Pediatric heart conditions include holes in the heart and valve anomalies, among other things. But there's a lot more to learn. In the studio to do justice to this topic are the Chief Executive Officer of Duchess International Hospital, Dr. Tokunbo Shitabe, and Consultant Cardiothoracic Surgeon, Duchess International Hospital, Dr. Michael Sanusi. You're welcome to the show.
Hello, thank you. Thanks for having us.
Thank you.
Dr. Sanusi, let me start with you. I don't know if other people were like me, But when they say hole in the heart, we just think that right in the center of the heart, there's a hole going from the beginning to the end, like, maybe a bullet went through. Describe what a hole in the heart looks like.
Okay, thank you. So a hole in the heart, there are actually 4 chambers in the heart, like 4 rooms. They're connected by doors, so to speak. And those rooms are supposed to have walls in between them. So when there's a defect in the wall between chambers, that's a hole in the heart. There are 2 upper chambers, 2 lower chambers. If there's a hole between the upper chambers, that the septum, which is the wall, doesn't develop
septum
fully.
Is wall.
Yes.
You're just using a lot of Latin to confuse us.
Oh, right.
All right.
So there's a hole in the wall in the heart. Then there's 2 chambers that are connecting abnormally. Everything in the heart's supposed to go in continuity. Go out through the door, come back through another door. So so when there is an abnormal connection, that's a hole in the heart.
Dr. Shitabe, what causes these conditions? For Precious, it was an aneurysm or, a vessel that expanded due to the weakness of the wall or something. What causes these things in children?
Right. I think, as I'm sure Dr. Snissi will talk about a bit more later on, the predominant cause of structural heart conditions in children is it's overwhelmingly congenital,
right?
Isn't it? What it means really is that these children are born with these conditions.
Yes, but why?
Yeah, and there are perhaps certain things that predispose children to being born with these conditions, but I think what's really, really important is that these children are born with these structural abnormalities, this hole between the upper or the lower chamber or some other part of the apparatus, and they often come out either deficient in their circulatory mechanism, or they have evolved some other coping mechanism, some other connection has opened up elsewhere in order to give the lungs and the tissues the required oxygenation. Either way, it does need to be fixed, and there usually is a time limit to fixing these conditions.
Okay, Dr. Sanusi, you did the procedure on baby M. You spoke about a ventricular septal defect. That's the lower chambers of the heart had the problem at the wall.
Yeah.
But so far we're talking about valves, are we not? Or just walls? What are the other things that cause heart diseases in children?
Well, yes. So like Tokumbo said, there can be most of them are between the walls. Sometimes even the valves have problems. The heart forms takes like 12 weeks, the first 12 weeks of life, 10 to 12 weeks for the heart to form fully. It's a very intricate process.
First 12 weeks?
Yes.
Wow.
Of the pregnancy, the first trimester, that's when the heart forms. So, and there's a lot of twists and turns and walls coming together and dissolving. So it just takes maybe one day of something or two walls trying to align, and then they misalign or something. It doesn't take much
chance.
at all. Yes, by chance.
Some fluke.
Yes, by chance. Not most of the time.
So this one is for parents at home. A heart condition is a very serious matter, and for a child, to be born with one, a child who can't speak, who can't express itself, who can't say what is wrong, how does a parent know that there's a potentially dangerous system, a potentially dangerous problem afoot with the child?
Yes.
What are the symptoms like?
Yes, just like on the video you just showed, the child might is usually getting tired because there's heart failure. So the child doesn't feed very well. It falls asleep very easily. Is always asleep, and sometimes they start to look a little dark around their lips. That's called cyanosis.
Okay, not enough oxygen.
Yes, because they don't have enough oxygen, and again, sometimes the first presentation may be a pneumonia. Okay. Just an infection, and then they go to the doctor and to treat pneumonia, and then the doctor listens, while listening to the lungs and the heart, hears a murmur. That's an abnormal sound. And that might spur an echocardiogram, which is an ultrasound of the heart. That's what really shows where and what the defect is like. But many times the dad and mom would notice that the child is just tired, and not growing,
Not growing.
Yes, not growing.
Okay, that's something that I can hold on to. Mm-hmm. Within the time that this becomes really dangerous, isn't the mother supposed to have gone for some sort of visit to the hospital with the baby, where the doctor will actually see the child, and perhaps will be the first person to notice there's a problem?
Yes, mom's supposed to, even when the baby is born, there's one of the things that's done is that the oxygen saturation of the baby is gotten in the delivery room. There's some heart diseases where it will be low, and that can immediately let the doctors think, the medical staff think there's something wrong. And then, there's a well visit, where when the baby's born, a couple of weeks after the baby's born, supposed to go back to the hospital, and then they're supposed to be examined again, and really you should listen to the heart. But sometimes these things don't show up at that visit for some medical reasons. There's the lungs are still not fully developed, and they're a bit hypertensive. So even if there's a hole in the heart, the pressure on both sides of the heart are the same, so nothing flows through that hole.
So the flow is affected.
Yes, so you can't hear it. Oh, yes, okay. So it takes about 6 weeks sometimes for these things to show up, even though they were there at birth.
Mm-hmm. And that really does underscore the importance of a structured healthcare system that offers regular health checks. Because that may be a snapshot in time, you can't pick it up, but you may be able to pick it up 6 weeks down the line. But where that system of postnatal checks, for example, is not in existence, not just in one locality, but generally, and that really is also a function of how well healthcare is organized and funded.
Yes, the healthcare system generally.
So these are the things that really are playing out in the symptoms and presentations that we see in children.
Okay, so I'll be taking a very short break. Stay with us. We'll be right back. Welcome back. It's Health Matters on Channels Television, and we're talking about heart health in children. I have with me Dr. Shitabe and Dr. Michael Sanusi. Dr. Shitabe, I overheard you saying, to my shock, that registration is still 5,000 naira at the Duchess Hospital. That has to take some help. So, but I'm wondering, can we look forward to a time when the lower income earners can actually come with confidence to the Duchess and get care?
Absolutely, and I will say that time is now. You have said yourself that to register at the Duchess is 5,000 naira. We have been singing the same tune for 3 years now. It has not changed. I dare say for as long as I remain Chief Executive of the Duchess, it will remain 5,000 naira. It's a very clear, very definite strategy to lower the barriers to access to the sort of healthcare that we provide. So that certainly is the case. We open up our service to HMOs, private payers, insurance payers. We use all of our connections and collaborations to bring down the cost of high quality care. And what we have said repeatedly as well is that we are the direct beneficiaries of lots of interventional funding from the Bank of Industry through Axis Bank and the Central Bank of Nigeria. So yes, we have had help. And as a responsible organization, we have a duty, therefore, to pass those advantages, those benefits on to the deserving end user, i.e. Nigerians.
Still, 1 in 1,000 children have this condition. Dr. Sanusi, where are all these children, or are some of these cases, shall I say, unimportant enough, small enough that they can be ignored, or do they just resolve on their own?
Well, let me start by saying that a lot of children go undiagnosed, and they never get diagnosed. You can, they don't. Maybe in the rural areas, they don't have right health.
They have all these symptoms and they don't get diagnosed.
They don't get diagnosed, because the same symptoms with pneumonia, a child can keep coming back to hospital with pneumonia. A child may not grow, and nobody figures out why. But although there's a small subset of children that would improve, when I say 1 in 1,000 children, it's a few children will have very minor heart problems that would close, but you don't know who would close and who would not. They need to be
best to just come
to see a specialist.
Would you know by looking at the case?
No way.
If it's going to close?
No. In fact, sometimes those that have really big defects are those that you cannot even hear the murmur because they're so big.
So when you go in there, you feel, everything is okay.
Yes.
But because of the symptoms, you're compelled to go check further.
Yes. And checking is so simple, so it's non-invasive really. It's using ultrasound, no x-rays or involved. It's just sound waves, and really, if there's a suspicion at all, the child should get an echocardiogram or ultrasound of the heart. And if everything is normal, thank God. But,
so checking is simple.
Yes.
But Dr. Shitabe, let's say the person doesn't have symptoms, no heart problem, no symptoms, is growing normally. Is there an age that somebody should start checking for heart health?
Yeah.
And what is that age?
Okay, so I'm conscious of the fact that the context in which we are speaking is that of a heavy burden of disease.
Yes.
And we're talking also about a supposedly normal population. Well, that is the essence of screening. And with screening, you are essentially looking after, you're trying to identify disease in an ostensibly normal population. Given what we know about heart disease and other conditions, again, the pace of life in this country, that age is as low as you can get it. Certainly from a cardiovascular point of view, we encourage, certainly from your early 20s. So all of our wellness and screening packages, for example, at the Duchess, are aimed at age groups starting in your early 20s, what we call the lifestyle basic, going up to comprehensive health screens.
But what are these parameters that they are checking?
Okay.
Is it an ultrasound? What are they checking for heart health?
Certainly for cardiovascular disease, we have to think in terms of what we call risk factors. So it's that summation of risk that you are focusing on, because you don't want the patient to get to the endpoint being heart disease and stroke or open heart surgery. So you're looking to identify very early those risk factors. Diabetes is a risk factor for heart disease and stroke. So blood glucose, what we call the HbA1c, that looks back at blood glucose control over 3 months. Cholesterol level, for example, is another one, ECG, where it's indicated, of course, echocardiogram, scan of the heart, as Dr. Sanusi has said. In addition, of course, to those regular checks with that is the place of the family physician, for example. So I would very much encourage that people keep a family physician service. It's not a bad thing at all. In fact, it's a good thing to see your GP, family physician, every 3 months.
And if you're normal, what you're looking at is your blood pressure, your cholesterol level, your sugar.
Sugar level, that's it.
Okay. So, Dr. Sanusi, if a child has a heart problem and it's not attended to, what are the complications that could result? I'm hearing you say stroke. Can a baby have that?
A baby can have a stroke. Usually this happens if some of the heart diseases are called cyanotic heart diseases. So
something to do with oxygen again.
Yeah, so when there's not enough oxygen in the body produce a lot of red blood cells, and when the blood becomes so thick and dense that it can sometimes have a problem going through the small vessels in the brain and can cause a stroke or infections in the brain as well.
Oh, okay. So the earlier the better.
Yes. Oh, yes, absolutely.
And absolutely. I'm so glad we put in those questions because time is up.
Oh my God.
Thank you so much for coming to the show, Dr. Tokunbo Shitabe and Dr. Michael Sanusi. So good to have you around. Thank you.
My pleasure.
For being our guests on the show as well. From your end, watching the program, have a wonderful day. I am Mary Alale Yusuf.